Tips and products for delivering daily oral care. Assess the patient's needs daily. Identify risks of any oral conditions and set a daily oral care plan. Review what medications they are on that may create concerns with oral care. Depending on the patient, more than one care provider may be required to deliver effective oral care. As an example, someone may need to hold the resident's head or operate the suction device while another brushes. Make sure to set up all oral care equipment before you start and know what oral care products you will need. Protocol do's and don'ts. The most important goal in providing mouth care to frail and palliative patients is to maintain optimal oral hygiene with minimal discomfort. Don't use medium or hard toothbrushes. These are not appropriate for anyone to use, especially someone with dry mouth and sensitive gums. Firm bristles can tear gum tissue and cause bleeding. Do use an ultra-soft toothbrush twice a day with a very gentle brushing or patting action. The gums may be tender. Don't use mouthwashes that contain alcohol. They will dry out the mouth and irritate the gums. Do rinse with saline, soda water, or neutral fluoride rinse after every meal, or use a moist gauze to wipe out leftover food from the cheeks and under the tongue. Don't use lemon or glycerin swabs as they can have a drying effect on the gum tissues and usually just move food around the mouth without actually removing it. Do provide a saliva substitute to the mouth 2 to 6 times daily to keep it moist. This may help to prevent issues with swallowing and to maintain oral health. Don't use petroleum-based products for lip care. These products actually cause tissues to dry out. The petroleum coating also prevents the tissues from being moistened by natural saliva and may prevent harmful bacteria from being washed away from the mouth. Do apply a non-petroleum water-soluble moisturizer to the lips 2 to 6 times daily as needed. These types of lubricants are available commercially. Toothbrushes. It is best to use a soft or ultra-soft toothbrush because the gums are tender and can bleed easily. Use a gentle circular or patting motion to remove debris from the patient's mouth. You can also use an end-tuft brush or a proxa brush to get between the teeth and massage along the gum line. This is sometimes easier for you and the patient and is an alternative to flossing. Glycerin swabs are not ideal for cleaning the mouth and teeth. Their small size make it difficult to remove debris from the mouth appropriately, and they are not effective in removing plaque from the teeth. Patients can swallow the swab applicator and aspirate. Toothpaste. Toothpaste can be used when a patient has demonstrated that they can spit properly. Otherwise, toothpaste should be avoided. Plaque and debris can still be removed with gentle brushing with water alone. Sometimes toothpaste causes a burning sensation on the tissues. Too much toothpaste can cause choking or gagging. When toothpaste is used, only a pea-size amount should be applied to the toothbrush. Mouth rinse. Mouth rinses can be used if the patient's ability to swallow and spit is known. They should be alcohol-free. A 1-to-1 mixture of hydrogen peroxide and saline, club soda, or a mixture of salt and baking soda in 8 ounces of water are all useful alternatives to mouth rinses. Mouth props. Mouth props are a valuable tool when it is hard to get the patient to open their mouth or keep it open. The patient can gently bite on the white spongy mouth prop to help relax the muscles of the jaw while oral care is being performed. Denture care. Dentures are just as important to keep clean as teeth are. Bacteria can get in under the dentures and cause inflammation or infection. Clean dentures after each meal to make sure that no food is left under the denture, which can cause irritation and lead to infections. To avoid irritation of dry tissues, Make sure that dentures are moistened before placing them back into the mouth. Patients may prefer not to have their dentures in at all. To help with denture comfort, dry mouth products such as water-soluble lubricants can be placed under the denture to make it more comfortable. Weight loss can also cause dentures to become loose and create problems with swallowing and sore gums. Dentures may have to be refitted by a dental professional.